Good afternoon.
Good afternoon.
We begin with a question by Steve Alquist of Uprise RI. Will undocumented immigrants availing themselves of public service during the pandemic be penalized under Trump's public change rule, endangering their ability to become permanent legal residents or citizens?
Yeah, thank you for the question. I want to speak directly to Rhode Island's immigrant community. We want you to be safe, and we want you to come forward, get tested, and get health care. None of the information that we take from you will ever get into the hands of an immigration authority. There are no immigration officials at any of these testing sites, even though they look official and there are people in uniforms. You do not have to pay. If you show up, you will not be asked to pay. And there are places that you can get for a test, and there are places that you can receive treatment for free, the various free clinics. So if you're in these communities, life is already difficult and there's a lot of reason to be afraid. I need you now to know we are going to do everything we can to take care of you and your families. And if you feel sick, please get tested. Go to CVS.com, call your doctor, go to CVS.com and sign up for an appointment to be tested. Call your doctor, sign up for an appointment to be tested. If you are sick, make sure we get you the right care, and don't worry about paying your bills for health care expenses as it relates to COVID-19. We're all in it together, and we want to make sure it's in everybody's interest in Rhode Island for everybody to be tested and put in quarantine and isolation if they are sick, and for everybody to get the health care that they need and deserve.
Next question from Michael Bilo of Motif Magazine. Racial disparities reported from some cities, for example, Chicago and Milwaukee, and states, Illinois and North Carolina, outside Rhode Island show black and brown people disproportionately 2 times likely to have COVID-19 and 3 times likely to die if infected. Is Rhode Island measuring this? If so, what are the numbers? If not, why not?
Thank you. That's an important question because addressing equity is a key part that we need to continue to follow even during a pandemic. As we are collecting data, we are looking at demographics that help us understand the equity lens. How are people of various racial and ethnic groups impacted? How are people who have housing instability impacted? How are people who have differing abilities impacted? That's data that we are continuing to analyze because so much is coming in at one time. I don't have that in front of me right now, but I appreciate that question and the focus on continuing to make sure that we are incorporating the equity lens into this tremendous amount of work that we're doing.
Next question is for the governor. Where does the surge peak play into your plans to reopen the economy? Is it out of the question that we start to reopen the economy before we hit the peak, assuming testing, PPE, and hospital capacity is where it needs to be? This is from Matt Allen.
Yeah, it's a great question. So the answer is no, it's not out of the question. The truthful answer is we're still trying to figure out, or I'm still trying to figure out in consultation with public health experts, the CDC, other governors, trying to consume as much information as I can, trying to figure out exactly what needs to be in place before we can get to the business of reopening the economy. And the most important things are that we have an ability for rapid, widely available testing. We have an ability to quarantine and isolate as many people as necessary at any one time, even in a surge, and really effectively isolate people. That our hospital system is at capacity, including having necessary amount of ventilators and access to ventilators, and that we have necessary personal protective equipment across our system. I will be making announcements probably early next week, at least around how I'm thinking about reopening the economy. I will say this, there's not going to be a flick of the switch. In no scenario will I or any governor or anyone be able to say it's back to normal tomorrow. It's going to be a process industry by industry, new regulations, industry by industry, somewhat gradually, so that we could keep everybody safe. And as you can imagine, it's going to be much more difficult to bring back online businesses who rely for their business upon large gatherings as compared to other businesses in a more controlled environment. So more on that later, but I thought it would be important to give you a window into how I'm thinking about it. Hope to talk more about it late this week or next week. And the only thing I'll say is I think about it probably more than anything. And look, I would love Rhode Island to be among the first to start to see some commerce going again, because I think it's necessary. There is a link between economic health and physical health. And right now, there's a lot of people whose physical health and mental health is struggling, is not where it needs to be because of their economic condition. And I'm so aware of that. But by the same token, I can't let us go back to business as usual unless I can do it in a way that I know is safe, or as safe as possible.
James Nanny with Law 360 asks, are you still calling for a new or increased taxes in light of the COVID-19 pandemic, such as adding a tax tier to the property transfer tax or adding software as a service and lobbying to the sales tax base?
Yeah. So the budget that I proposed to the legislature in January is, I don't even know how or if it will resemble the budget that we wind up passing in June. We are in a whole new world right now. Our third largest source of revenue is the casino, which has been closed for months. I just explained to you we have over 100,000 people who filed for unemployment insurance. Our economy's done nothing for over a month and will for the next month. The good news, I suppose, is that we'll be receiving over $1 billion of federal stimulus within the next month. So all I can say right now I still have to get through this immediate crisis, keeping people safe, setting up our hospital system, getting our system ready for the eventual surge. We're going to have to get to the business of balancing our budget, layering in the federal stimulus. But the fact of the matter is we do need revenue. So our revenues have fallen off a cliff, and I will take the whole thing. I'm not going to comment now on one particular piece of it. I'm going to take it all in whole and work with the legislature in partnership and with the same guidelines. Keep everybody safe and healthy, maintain the state's liquidity, look out for small businesses and individuals who are in a great deal of pain, and still continue to look to make targeted investments in our economy, because we have got to get people back to work.
Next question is from Steph Machado of Channel 12. Mayor Elorza has closed all Providence parks to pedestrians, not just the parking lots, and also walking paths such as Blackstone Boulevard. Is this something you'd consider doing statewide, or does it go too far?
Yeah. So first I will say I respect the mayor and I respect his judgment, and none of us is making perfect decisions right now, including me. I have not taken that approach because I think people need to be able to do something. And as I've said so many times, going for a walk is good for your physical health and your mental health. Children are cooped up all day at home, doing their schoolwork. I think it's important that they be able to go outside and run around a little bit. So I'm not going in that direction, though I can certainly understand why he chose to. What I'm doing is I'm going to stay right where we are with our restrictions, not look at this point to increase them, but a lot of monitoring. So a week ago I was very concerned that the crowds in grocery stores and big box retailers were too large. It's gotten better since then. We're monitoring it. It's gotten better. The crowds over the weekend at our state parks and beaches were much smaller than they were a week before. So as long, I want everyone to be able to do as much as possible safely, and as long as we can enforce and have compliance with the rules that we've put out there, I'm going to try to hold the line where we are. But I absolutely respect the mayor.
Tara Granahan asks, Governor, people are wondering what the Lieutenant Governor's role is in this crisis and why he's not with you. Is he prepared to step in if need be?
The Lieutenant Governor has been a great partner to me, not just in the crisis, but since I've been governor. He's doing the smart thing, which is working from home, consistent with our directives, and I have every confidence that he'll do whatever is necessary at any time to help the cause.
Next question is from Jim Hummel. Many Rhode Island businesses have had to make the painful decision to lay off or furlough employees because they don't have the income to sustain the payrolls. The state of Rhode Island, likewise, has lost large chunks of revenue during the shutdown. When will you begin laying off or at least furloughing employees?
Yeah, so I'll make a comment and then I'll ask Brett Smiley to comment. First, I want to thank our state employees. Many of them are the essential employees that have to come in and work, so thank you for your bravery and courage and willingness to do the right thing. Secondly, we have thousands of people now working from home, which we've never done before, and I appreciate you being productive from home and helping us. Thirdly, I cannot say that furloughs and layoffs will never come, but I am going to do everything I can to avoid it, because the last thing I want to do right now is contribute to the state's unemployment rate. But Brett's doing a terrific job, and I want to give him a chance.
Thank you, Governor. And I also want to continue to thank our state workforce. One of the things that we've been able to do to continue to keep the risk of furloughs and layoffs at bay is continue to rely upon the cooperation and flexibility of our state workforce. And so I guess what I would say to add to the Governor's appropriate comments are that so long as that we can all continue to work together and so long as our workforce can continue to be collaborative and cooperative, we can keep pushing that threat out. So, for example, we've had other state employees volunteering some of the phone banks and hotlines at the Department of Health. Sheriffs who aren't in the courthouse right now, some of them are helping at DLT. So long as our state workforce continues to work with us, to be flexible, to be cooperative, and we're doing our part to be cooperative and flexible with them with things like telework and extra paid leave, then we can all try to get through this together, putting off some of the more painful decisions that none of us want to have to make. So we're going to continue to stay in close collaboration with the unions, with other department directors, and all the hardworking state employees so that we can try to avoid that possibility.
Next question is for Dr. Alexander Scott from Tanya Signori of the Rhode Island Echo. Good afternoon. Does sipping water every 15 to 20 minutes help prevent COVID-19 from taking over the lungs?
Thank you for that question, Tanya. There's still a lot that's being learned about COVID-19, so I have not learned any scientific information that says that water would help prevent COVID-19 from taking over the lungs. However, I do support getting sips of water on a regular basis, particularly seniors, those with differing abilities who are home. You may forget sometimes to make sure to stay hydrated and to do what you need to have the rest that you need to help protect against being impacted by COVID-19 or any other viral illnesses. So I strongly encourage doing things like taking sips of water to stay hydrated. It's something I talked to my mother about just yesterday to make sure that we are continuing to do what we need to help minimize risk of any infections overall, whether COVID-19 or otherwise.
Doctor, you've already commented on this, but Tony Mendez of POTR 102 asks, when will Rhode Island start reporting the racial breakdown of the COVID-19 cases? He says that he understands other states are already making this information public.
Yep, it's a great question. As with the other one, it's one of our focal points, and I'm going to get back with the team to see how we are with the data that's being analyzed and collected to be able to start sharing that, because we do want to make sure that the types of demographic information that I shared earlier continue to be in our forefront as we help understand how Rhode Islanders are impacted by this pandemic and respond to that appropriately.
The next question is for the Governor from John DePietro. Could you advise residents of Providence the rules for walking, running, and dog walking?
All are allowed. I would encourage them all. You ought to walk, run, fast walk, jog, dog walk, do whatever you can to maintain your physical, mental health, and I'm a big believer in getting some fresh air. The only thing is, social gatherings are limited to 5 or fewer people. So if we see you out and about, outside, in a park, in a dog park, closely gathered with a bunch of people, we're going to ask you to separate yourselves. And again, I would just remind you, we don't want you hanging around with a different 5 people every day. So if you have 4 or 5 people in your family who you're living with, go for a walk with them. That's fine. We want you to continue to do that. What we don't want you to do is go to the dog park and see all of your neighbors, and before you know it, there's 5, 6, 7, 8 of you all congregated closely. That's a problem, and if we see it, we're going to break it up.
The next question is from Alan Gabberty. Information obtained from the Rhode Island Department of Health projects COVID-19 related deaths for April over 2,300. Is the administration and the Department of Health securing PPEs for funeral homes as well as healthcare workers? And given the number of projected deaths, what is the state prepared to do to help funeral homes given increased safety and financial instability?
Unfortunately, these are important questions that we are fully prepared for and addressing on a daily basis. We are having conversations with funeral homes, funeral home directors on a regular basis, being responsive to them as they are engaging in the different activities that are happening now. We definitely want to make sure that they have the supplies that they need, and so our personal protective equipment supplies that can be made available to them has been occurring and been exchanged and offered to them. And we have actually, through one of our work streams of teams of people that are focused on surge planning, we have an entire focus on being able to respond to an increased number. So we appreciate the folks on the team who have been leading that effort, and it is a key component of our overall preparation as a state.
And our last question for this briefing, even with 2,000 tests a day, do you believe that will meet the demand? We're still hearing from many who are trying to get tested and cannot. This is from Kim Kalunian of WPRI.
Yes, these numbers that we're sharing, over 1,800 tests were performed yesterday. There is capacity to continue to expand beyond that. We are aiming for beyond that. We want to be able to test anyone with symptoms who is out there so that we can get a better understanding across the state of what's going on. The process has been unfolding over the last few days, so people have been patient and on some lines, but as we continue to expand, CVS will continue to expand, the commercial laboratories, and of course the Rhode Island Department of Health State Health Laboratory, which has been doing this since the very beginning, are all working very hard to make sure that we have the capacity to test as many people as we can. So continue to get that word out. We are expanding to do it. The National Guard has been partners with us, so many across state government, to make sure that we can respond to the increased capacity needed for testing, because we know how critical that is, along with the contact tracing component to be able to get people quarantined and isolated appropriately as they need to.